Hi, and welcome to Askimo TV. We're talking today to Dr. Kulvinder Lall. Dr. Lall is a leading UK heart surgeon. Hi, Dr. Lall, how are you?
Good morning, I'm well, thank you.
Wonderful. Dr. Lall, let's talk a little bit today about heart disease. What is heart disease?
Heart disease encompasses quite a range of diseases, but generally when people talk about heart disease, it means furring up the arteries, the coronary arteries, leading to heart attacks and to angina. And I think generally that's what's meant by coronary artery disease. There are other types of heart disease which involve the heart valves, but this is a general, is a slow process, mainly affecting elderly people when they have calcification and rheumatic fever affecting the heart valves, which causes a failing of the heart valves. So heart disease in itself is quite a wide encompassing term.
What are the main causes of heart disease?
So for coronary artery disease, the main causes, there are 5 main causes: diabetes, hypertension, high cholesterol, family history, and smoking. Those are the big 5 risk factors for heart disease.
What are the risk factors to heart disease should you leave it to go untreated?
If you were to leave all these 5 factors untreated, what would happen is that your normal coronary arteries will gradually fur up with atheroma, which is a combination of thrombin, platelets, and calcium, and these would cause narrowing in the blood vessels of the heart, leading eventually to lack of blood supply in the heart muscle, causing angina and eventually heart attacks.
What are some of the symptoms of heart disease?
So the main symptoms, 50% of patients would suffer a heart attack without actually getting any symptoms, but generally patients would get some chest pain, which is typically a tight central chest pain radiating down the left arm. This is one of the main presentations. They can have chest pain also in their throat. Some patients present with myocardial infarctions, which are heart attacks, which are sudden drops in blood supply to the heart, causing areas of damage. They can also suffer from shortness of breath and generally tiredness and inability to perform their normal daily activities.
How is heart disease diagnosed and treated?
Heart disease, in the first instance, patients should go and see their primary care physician. They should present a history because there are many other conditions that can mimic themselves as heart disease. So the primary care physician or general practitioner would be able to sift out the patients he thought were having these other symptoms and who were having coronary disease. If the primary care physician then thought that the patients were having something to do with their heart, he would refer them to a cardiologist, who would then perform an ECG, take a history, and possibly arrange for an angiogram for the patient. If the angiogram is positive, then the third step is that they will be referred to heart surgeons such as myself.
Is there a cure for heart disease, and can heart disease be prevented?
Heart disease can only be prevented by primary prevention, so cutting down on the 5 risk factors I mentioned. So if you smoke, you must stop smoking. If you have high cholesterol, make sure your GP puts you on cholesterol tablets. If you've got high blood pressure, keep that under control and try and lose weight as much as possible. Once you have established heart disease, the atheroma and the blockages are quite difficult to get rid of just by medical therapy. The question is to whether treatment is available, which is in the form of cardiologists putting stents into coronary arteries or by cardiac surgeons performing bypass surgery. And it really depends on the pattern of disease of the coronary arteries as performed by the angiogram that determines into which category patients would go. But essentially, it is curable and can be treated.
Dr. Lall, who's at higher risk for heart disease? Is it men or women, and why?
Generally in the UK, it used to be men, but I think it's now equalising out. And the risk used to be higher because men used to smoke more, they used to eat more red meat. But now that the socioeconomic classes are equalising out, the heart disease is equally prevalent in men and women now. Generally affects patients in their 40s onwards, with a peak of incidence around 50 or 60. But if you have high cholesterol and diabetes from a young age, it can affect you from a much younger age.
Thank you, Dr. Lall. Thank you so much for talking to me today.
Pleasure.